Hi, thank you for joining me today. We will be talking about sleep, which is one of my favorite topics. My name is Dr. Brandy Roane. I'm an associate professor of physiology and anatomy with GSBS, as well as associate professor medical education with TCOM. Um, for today's talk, like I said, we will be talking about sleep. There have been several questions that were submitted with regards to sleep, and we will be answering those today. These include a wide range of topics, from basics of sleep, like easiest way to know if you're getting the optimal amount of sleep, to whether sleep changes throughout the lifespan, if naps are okay. We'll be talking a little bit about dreams, as well as sleep problems, and different things with regards to sleep aids and some approaches to take. How we're going to do this is we will make sure to answer all of these questions as we go through. Um, However, it is going to cover probably even a little bit more information just to give context as we're answering the questions. So there will likely be some things answered that you didn't necessarily think to ask, or you had thought to ask but just didn't include it in our query to begin with. So without delay, let's go ahead and get started. So the first off is, let's first talk about what is sleep. So if we're talking about sleep, we're asking all these different questions. It's probably going to be helpful if we figure out what is sleep. Well, if you look in Merriam-Webster's dictionary, they define sleep as the natural suspension of consciousness during which the powers of the body are restored. That is a wonderful definition, and sense of it sounds so light and fluffy. However, as a researcher, I read that definition and go, that is not something I can measure. So when we are actually talking about sleep, we're talking about several different things. It can mean several things. So what are these things? One thing that sleep can mean is how much sleep you got. This is also referred to as duration. This is different than the time you spend in bed. This is specifically how much time did I actually spend sleeping in whatever location you were sleeping in. So sleep can also mean when you slept, so sleep timing. So for instance, we might ask, like, when did you go to bed last night? Things of that nature. Another thing that we might ask is, how well did you sleep? So how well you slept is what we call quality. Now, sleep quality is not solely dependent on sleep duration. You can sleep a short duration, so you get insufficient sleep, but your quality of sleep can be good. And we will talk about that as we go through these slides, what we really mean by quality. But this is often a subjective rating, like, I don't really feel I slept well, or it could be based on more objective data where we've recorded sleep and we've identified that somebody has woken up or had arousals numerous times, where they might not be aware that they woke up or had these arousals because they don't recall it once they fully wake for the morning. But we would identify it as poor sleep quality. And you'll see this in things like obstructive sleep apnea. So when I'm talking about objective or subjective, let's quickly go into kind of how sleep is measured. And this will hit on one of the questions asked with regards to measuring sleep or assessing for things. So how sleep is measured is either through objective or subjective tools. Subjective tools include things that are self-report, like sleep diaries, questionnaires. Sleep diaries are incredibly helpful when we are talking about things like insomnia or delayed sleep phase, because really what we need to know are subjective reporting of waking up in the middle of the night or delays in falling asleep, as well as timing. And we often, if we rely on just self-report of, they come into the office and we say, okay, so how much sleep do you normally get? People will either remember last night or the worst night, and they have a really hard time remembering that day-to-day variability, which is incredibly important. So when we're talking objective measures for sleep, we're talking something called a polysomnography or PSG study. This is more commonly referred to as a sleep study in layman's terms, but it's a collection of measures which we'll talk about in just a second. Another way we'll objectively measure sleep is called actigraphy or an activity monitor. So this is similar to a Fitbit or a Apple Watch that tells you sleep. However, these are validated objective activity monitors meant for the intention of measuring sleep, because they've been compared to our gold standard of sleep, which is a polysomnography. Your Fitbit, your Apple Watch, things of those natures have not been validated against polysomnography, so they are not as accurate. They will actually often underreport the amount of sleep somebody gets. So a sleep study or polysomnography is going to measure several things, including brain waves, eye movement, muscle movement, heart rate, breathing patterns, and body position, in order to let us know sleep staging. So EEG recordings allow for the determination of that sleep staging. In essence, what we are wanting to be able to determine is if somebody's awake, if they are entering stage 1 sleep, if they are entering stage 2, stage 3, and stage REM. And these are going to help us then determine if something is wonky with their sleep, or if they're getting sufficient sleep, hitting all their staging and that kind of thing. If you look on this particular slide, there's a couple of pictures, but also kind of gives you an indication of what those sleep stagings look like when we take the EEG recordings. When we translate those EEG recordings to sleep staging, we then will map it out on something called a hypnogram, and that is to the right where it looks like a cityscape, and I'll hit on that in just a few minutes when I talk about staging, and particularly what it means for you to be in each stage. However, there are some key characteristics. So for instance, in wake sleep, you will have alpha waves. Stage 1 is strongly dominated by theta waves. Stage 2 has something called sleep spindles and K complexes. Stage 3 is deep sleep, and this has delta waves. Stage REM is going to also consist of theta waves like your wake, or like that stage 1, that transition stage. It will also have some beta waves and that kind of thing, but the waves look different. You'll notice they look kind of jagged compared to stage 1, which is transitionary, and we'll touch on that in just a minute. Another way to measure sleep is a home sleep test. So this is a monitoring device that does not record signals required to determine sleep staging, but is really intended to measure things like obstructive sleep apnea. Now, if cost is prohibitive for getting a lab sleep study, which it can be because those can be anywhere upward to a couple of thousands of dollars, you can opt for a home sleep study, which can run about $100 to $150 depending on where you go. So this can be a lot more cost effective in order to determine if you have obstructive sleep apnea or not. These particular measures are going to have 4 physiological measures to them. It's going to have 2 respiratory, so being able to look at respiratory movement. Are they exhibiting effort? And is there airflow, which helps us determine if something is a obstructive sleep apnea event or if it is a central sleep apnea event. The other thing it's going to have is cardiac variable for us to look at heart rate and oxygen saturation, because for us to code obstructive sleep apnea or central sleep apnea for an adult, we have to see a drop in oxygen levels combined with an obstruction that is occurring. Now, I told you also there was that ability to be able to measure things using actigraphy. So this is where you have an activity monitor that's usually worn on the wrist. It's going to count movement, and the algorithm is going to approximate sleep. Where this is different, like I said, than that Fitbit or the Apple Watch or any of those other measures or those other activity monitors, is these are actually validated against a polysomnography, which has recorded EEG measures for us to be able to stage sleep. So we know that the person was asleep when this should have been indicating the person was asleep. Your Fitbits, your Apple Watches, those are not validated in that same way. They're approximating it, and often they underestimate. And that can be problematic in the sense that the person feels they need less sleep than they actually do need. So let's talk about what happens when we sleep. Sleep is a really dynamic and complex state. It's way, way more than just a power down. There are 2 types of sleep. I've already kind of briefly mentioned them, but one is non-rapid eye movement or non-REM. The other is rapid eye movement or REM sleep. Non-REM sleep has 3 stages. We refer to them as non-REM stage 1, non-REM stage 2, and non-REM stage 3. Now, non-REM stage 1 is a transition stage. We wake easily from this stage. This is that stage where as you're falling asleep, if someone calls your name or a door closes, you're easily going to wake up and you're going to be alert. It's going to be annoying, but you will be alert. Stage 2, you are fully asleep, but you can be alerted easily, more easily than your other stages. However, um, you are considered fully asleep at this point, and you are going to spend the largest percent of time in this particular sleep stage of any other stage. Stage 3 is also called deep sleep. It is where delta waves occur, and this is slow wave sleep. It is hard to rouse from this stage. This is the stage in which the body is restoring and stores memories. Now, this is different than REM sleep because during non-REM stage 3, you are completely asleep in the deepest state possible. If you have built up sleep pressure, which we'll talk about in just a few, you will want to get into this stage. Your body will more frequently and for longer durations than than you actually need to, because it's trying to alleviate that pressure. This is also the stage in which sleepwalking, sleep talking, and sleep terrors occur. What happens is during this stage, somebody is in the deepest sleep stage possible, and an environmental stimulus will happen that triggers part of their brain to wake up, their autonomic nervous system, particularly their fight or flight response. So they will engage in complex behaviors like walking, talking. My teens have been known to sleep text. They will have no recollection of this occurring, however, because they are not actively conscious on any level of recollection during this stage. Infants will engage in sleep terrors. This is where they look like they're awake, they're screaming bloody murder, but they are actually fully asleep during the stage. People can also be aggressive during this stage because it is activation of the fight or flight or freeze response. So if you go to engage with them, they might combat you thinking that you are a threat. And it doesn't mean they're awake thinking you're a threat. It means that they are operating on that fight, flight, or freeze response, and they might become combative. So this is typically why people would say it's not a good idea to wake a sleepwalker. It's not because you can't wake them or it's going to hurt them to wake them. It's actually often because it's incredibly difficult to wake them from this stage. And you might find that you are putting yourself in peril trying to wake them because they will get incredibly aggressive at times. I've worked with kids where they've hit, scratched parents who've tried to wake them or comfort them during the stage, thinking they were having a nightmare. Now, nightmares don't occur during this stage. Again, they are not aware of what's going on. Nightmares occur during REM sleep, which is your final stage that we're going to talk about. REM sleep, or rapid eye movement sleep, is a very active sleep state mentally, but not physically. So during each of your sleep stages, you're going to progressively, during non-REM 1 to 2 to 3, lose some of your muscle tone during each of those stages, progressively more. However, during REM, you have complete muscle tone loss throughout the body except for in two areas, your eyes and your diaphragm. That's so you can breathe. And the other thing that happens with the eyes is you will get a jagged eye movement. And this is actually why this particular stage was identified first over all of the rest of the stages, because it doesn't require a polysomnography to know that the person is in this stage. You will be able to be aware that they are because their chin will drop out, meaning if you are a mouth breather, you are a major mouth breather during this stage. If you aren't necessarily a mouth breather, your mouth might kind of open because you lose muscle tone in the jaw. Their eyes are also going to jerk back and forth, hence the rapid eye movement. And so you're able to identify that somebody is in this stage without them actually being hooked up to anything. Dreams also occur most often in this stage. You can have dreams during stage 2, but dreams occur most frequently during the stage. And this is also a stage where the brain is actively trying to clear out clutter. Now, one of the questions we had is, are dreams good or bad for health? Dreams aren't necessarily good or bad in the sense of dreams are just dreams. We don't know particularly why we have them, other than if you really think about what goes on in the body while we sleep, part of what we are doing is processing memories. We're moving them, transferring them to long-term storage. Now, there can be things that we think on kind of at a subconscious level, not an unconscious, but a subconscious level, where when we go to sleep, we've actively been thinking on them. So our brain is going to be storing and clearing out clutter. So it's very possible for a sequence of those things to play out in a dream in some way, because your brain is processing through and storing things in long term during that deep sleep. And then you're going to transition right into REM as it's clearing out clutter and doing other things so it can replay things. This is also why you can experience a reoccurrent dream. Is a reoccurrent dream can start to become an actual memory, or at least our brain will process it like a memory. So it's going to recall it, especially if you kind of think on it before you go to sleep. You're like, oh my gosh, I hope I don't have that dream again. Or I wonder if I'm going to think about that or have that, happen again. You can actually cue those kind of events to occur. Um, Now, as far as frequency of dreams increasing with the pandemic, that can be for a couple of things. So, some people have noted that they are experiencing more frequent dreams since we've had the shelter in place and the quarantine. Part of that is for two reasons. And I'm going to skip to the next slide because this will make more sense. If you look at a cityscape or a hypnogram of sleep, you will notice very quickly that, sorry, I skipped ahead and I didn't mean to, that there you transition from wake down to stage 1, 2, 3, which used to be stage 3, 4. You're going to be in that for a little bit before you pop back up to 2 and then into REM. Now, REM occurs most dominantly at the end of the night, whereas you have deep sleep most prominently at the beginning part of the night. When we don't get sufficient sleep, meaning you fall asleep at 11, but you know you have to be up at 5 a.m., you get up, you don't experience that last sleep cycle with that big push of REM. Well, with the pandemic and us having the shelter in place, which means less commuting, following a more consistent schedule that you are kind of your innate schedule, which is a little bit of a delay for a lot of people. It's more similar to their weekend schedule. You are now typically sleeping a little bit more than you possibly were previously, which means your body is going to actually be hitting all of your sleep staging for the duration it potentially should be experiencing it. So you are more likely to have more REM now if you are sleeping for a longer duration, and more REM means more opportunity to dream. Um, if you weren't necessarily short sleeping prior and you're noticing an influx in dreams, particularly scary ones or things that are causing you alarm, it could also be driven by anxiety, or again, like we've talked about, dreams can occur because we are thinking about certain things during the day and our brain is processing it. So one of the biggest things that a lot of people have noted is a lot more anxiety since the pandemic started. That is in part because this is a very scary event for a lot of people because there's a lot of unknown factors. The other thing to consider is in more recent history, there has been an upsurge in number of anxiety disorders diagnosed. It isn't because it's now a more recognized disorder. Anxiety disorders, just like depression, are some of your most frequent and common disorders that have always been diagnosed. There is an upsurge, though, in the sense of people are experiencing more stress, more things are coming at them where they feel overwhelmed, and these are symptoms of anxiety. So this also means that if you tend to be a little more prone to anxiety, something like the pandemic and quarantine can exacerbate those symptoms. And that can make sleep more difficult and can also affect your dreams. Okay, so let's also talk, because one of the other questions that was asked is sleep throughout the lifespan, and does your sleep need change? Yes, it does, and we'll talk about specific sleep needs in just a moment. But just to give you an idea, this particular slide talks about sleep and your staging as you go through life. And you'll notice that up until the age of about 24, 25, actually even up until about the age of 35. So we typically consider, while most people don't like to hear this, adolescence lasting till about the age of 24, but even up until about the age of 35, there is a greater sleep need. Now, you'll notice that it kind of plateaus after that point. There is a little bit of a decrease in sleep that occurs later in life, so about the age of 75 on, but that you'll notice is due to sleep latency increasing, as well as wake after sleep onset increasing. And this is not because their sleep need lowers. This is simply because medications that happen, chronic illness, those kind of things can impact sleep and cause a reduction in sleep. Doesn't mean their need has reduced. It simply just means the amount they get is reduced because of those factors. Another thing to consider is sleeping through the night for infants. So that's one of the questions. I didn't have that particular on this one, but it's a common one asked and can be helpful when you're working with patients. Is on average, by 12 weeks, 75% of infants can sleep consistently for 6 hours at a time, which is what we kind of define as sleeping through the night. By 26 weeks, 90%. It's all in how it is set up. And if there's any underlying conditions that aren't present, that can also impact it. But often, if parents are working on putting their baby down drowsy, not fully asleep, where the child isn't forming a sleep onset association, the child can learn to sleep through the night up to 6 hours because they're still requiring a feeding in the middle of the night up until about 6 months, but they can do this by about 12 weeks, sometimes even earlier. As far as napping goes, so that was one of the questions in regards to, is napping okay or not okay? Just to give you an idea, biologically, the majority of us give up napping by the age of 4. After about the age of 7, biologically speaking, naps are no longer needed. If you are feeling the need to nap, it indicates you aren't sleeping sufficiently. Now, if you are working on a new schedule, having a brief nap, by brief I mean 20 minutes or less, before 2 o'clock, can help with that shift, but you don't want to utilize a nap as a means of actual sleep on a consistent basis. Because as a species, humans are not meant to bimodal sleep or polyphasic sleep or biphasic sleep, so have multiple sleep phases. There has been some data looking at some boosts that you experience following a nap period as far as memory goes, because you did sleep. And again, remember, memory consolidation occurs during sleep. However, over the long term, in the studies that have looked at actual practitioners, so there have been studies where they've looked at monks, nuns, different things like that, where they practice biphasic sleeping because they will get up to pray or do other things, and thus promote a biphasic sleep. They actually show worse outcomes during the day, increased sleepiness, things of that nature because of this biphasic sleeping. So we often work best if we sleep in a monophase, a single phase. Now, impact of age on sleep. So again, speaking to this, does sleep kind of change? It does, simply because of because of more frequently occurring comorbidities that can interfere with sleep, medications. There is no decrease in sleep need, but it is harder for them to sustain sleep, largely because they also have a decrease in delta waves as we age. So you see one of the biggest drops in delta waves, so that's that deep sleep wave, when we hit puberty. There's about a 40 to 45% drop in those delta waves. And that continually decreases as we get older, making it harder for us to sustain sleep. And one of the ways to kind of capture this is, I love this little slide. It's 4 hours of sleep at age 21, I'm ready to party again. 4 hours of sleep at age 40, say one thing to me and I'll smack you in the face. So we just struggle with dealing with sleep loss, more so when we get older. It's not that our sleep need decreases or anything of that nature. It often is plasticity, our ability to manage things when we don't get as much sleep. But the reality of the situation is, even at a younger age, you will see issues arise when someone isn't sleeping sufficiently. So before I go into talking about sleep problems, it's going to be helpful to be able to talk about the two mechanisms that regulate sleep. And this is going to be crucial when talking about things you can do to help yourself sleep better. So the two mechanisms that regulate sleep are your sleep-wake homeostasis and your master circadian clock. They are connected, but these are distinct processes that help with sleep. Now, your sleep-wake homeostasis is what tracks your sleep need. Your suprachiasmatic nucleus, or your master clock, directs the body's internal circadian rhythms. Um, your homeostatic sleep drive is the pressure you feel to sleep. It is sleep dependent, meaning pressure builds when you're awake and it decreases during sleep, particularly during deep sleep. Your homeostatic sleep drive reminds the body to sleep, and it's going to impact how long and how deeply you sleep. Because if you remember, I told you, if you aren't sleeping sufficiently, your body's going to want to try to get into this stage for a longer period because it's trying to let off the steam. Now, this process impacts when you feel sleepy in terms of that actual pressure to sleep, but you have another system at play here that can work for you or against you. So your body is full of clocks. It doesn't just have one clock, but it is literally full of clocks in every cell, organ. There are clocks. These clocks are circadian rhythms, and they run on 24-hour cycles of biological processes. So circadian rhythm really means circa diem, so about a day. So circadian rhythm is about a day rhythm, so 24-hour. Your master clock is actually, it sits in your suprachiasmatic nucleus, and it's the master clock. It's going to coordinate all the tiny clocks throughout your body. It is entrained by light. What entrained means is it is set or reset each day by light exposure, particularly your first light exposure. That's going to tell that clock to get started for the day, and it's going to update the rest of the clocks. How this works is light enters the eye. The retinal ganglia cells in the back of the eye determine brightness, not duration, but brightness. And what I mean by brightness is anything above about 20 to 30 lux can be viewed as something to set this clock. We work best in super bright light to set it, but other light things can tell the circadian clock, can give it misinformation and indicate that it's daytime when it's really not. Now, this light doesn't have to come from the sun. It can come from any light source, but the sun is going to be the most powerful. So from the eye, the info of that brightness travels via the optic nerve to the master clock, which is in the suprachiasmatic nucleus that sits right behind the retinal ganglia. The master clock is going to push an updated time to all the body's clocks. So it's going to trigger spikes and falls in blood pressure, heart rate, regulate hormones for digestion, timing of bowel movements, urination, helps regulate when you're going to feel alert, strong, coordinated, all those wonderful things. Light's going to cue this clock, this master clock, to update, and it's going to start that process of those physiological changes that occur throughout the day. So to give you an overview of what that looks like, sorry, I jumped ahead twice, but here's what it looks like. You'll notice that throughout the day, there's different things going on, and this just kind of gives you an actual clock to give you an idea. But if you're on a stereotypical schedule, you're going to have a sharp rise in blood pressure about 6:45. Your melatonin's going to stop at about 7:30 once you get your first light exposure. That spike in blood pressure is also going to be combined with a spike in cortisol and an increase in body temperature. So this is also sometimes why you might feel hot when you're trying to sleep in on the weekend and you wake up feeling like you're extra hot. That is because your body was expecting to wake up at a time that it didn't. So it had already started increasing body temperature and blood pressure and all those things. You will also notice that shortly, a couple hours after waking, you're going to have the highest alertness for the day. You're going to have the highest blood pressure around 6:30, highest core body temperature about a 7 before things start dropping. You'll also have your lowest body temperature at about 4:30 in the morning before there's a sharp spike in it. If you stay up past your usual bedtime, you might also notice that you start getting cold. And this is because that your body is expecting that it's going to be getting ready for sleep. So if you haven't already started to fall asleep, it's kind of already in trying to get ready for sleep mode. You also have other external stimulus that can affect the timing of your master clock. This is when you interact with other people, how interactive it is, intensity level. So think stimulation. Stimulation can impact whether you're going to feel sleepy like you need to or not. When we're physically active, how long we're active for, and intensity level can also affect the timing of that master clock. Meals is also a huge one because your circadian timing system regulates hormone release, part of which influences like things like insulin, which helps control blood glucose, those kind of things. And this also feeds into that system, like your last meal of the day, informing your body that it needs to start preparing for nighttime. Now, you're probably wondering, I've talked about these two things, so how do these things actually work together? Well, if you think about it, your two-factor model of sleep in action is, in essence, you have that sleep drive. The longer you're awake during the daytime, the more pressure you build to sleep. When you sleep, you let off pressure. You'll also notice that that circadian rhythm is really awake promoting or an alert promoting system. There is a dip in it, however, in the afternoon, and we'll talk about how this can play out. If you are not sleeping, meaning you don't have excessive pressure built up because you started the day off with pressure, you're going to feel a lull in your energy. If you have excess pressure built up, it's going to be too high when the circadian clock pulls back, and you're going to feel like you need to fall asleep. So let's talk about sufficient sleep. So sleep is incredibly vital to health. As a matter of fact, the CDC has identified sleep as a vital sign of good health, meaning sufficient sleep is not a luxury, it's a necessity, and should be thought of as a vital sign of good health because it's going to promote health. So what does sufficient sleep mean? And this is going to be where I say it depends. It depends on a couple of things, particularly age. So this also gets back to that question of, does sleep need change throughout the lifespan? Once we hit about 18, our sleep need doesn't change. You'll notice this has kind of windows of time or durations, and that's because there's individual differences. Some people need 9 hours. Some people need 7.5. The average sleep need, or quick reference for this, is quick guides for sleep needs are, as an adult, average sleep need is 8.5 hours. As a teen, 9.5. 10 years old, 10.5. 2 years old, 12.5. Newborns, 16 hours. For newborns, that includes nap time, same thing for 2-year-olds. Once we hit 10, that should be occurring at a single time period. Now, we can to some extent function when we get a little bit less sleep. But one way to find out if you are actually getting sufficient sleep is think of the afternoon dip, that time period I've referred to just a little bit ago, between 2 to 4 in the afternoon if you're on a pretty typical schedule of like 11 to 7 or something like that. If you are getting enough sleep, you will feel awake. You're going to feel a little pull in your energy, but you're going to be able to function. You're not going to feel like you need to sleep. If you haven't gotten sufficient sleep, this is going to be the point where you're feeling you need to get up, move around before you fall asleep, or or you're going to actually fall asleep. You might also go seek out caffeine or something of that nature, trying to help yourself stay awake. Now, problem is, when you nap during this time window, you're going to stop building pressure because you're no longer awake. You're also going to release pressure, which means that you are basically giving yourself a double whammy. Not only did you stop building pressure, but we release pressure at a rate of about twice as quickly as we build it. So if you nap too long, particularly if you get into deep sleep, you're going to let that pressure off, which means that by the time you go to try to fall asleep in the evening time, it can be harder to do so because you let off too much pressure. Now, if we think about sleep need, do we all act the same when we don't get enough sleep? The simple answer is no. We might act similar, but there's going to be certain things that we might tend to favor when we don't get sufficient sleep. So these are other signs to look for. And we've all been there. So think about it in terms of the emotional responses, how we're feeling, that kind of thing. We might get angry. We might have a little more road rage. We might argue. We might get a little more irritable. We might be prone to crying or more anxiety, those kind of things. Some of us are going to get hyper, some of us are going to get inattentive, while some of us are going to appear more sad or manic or mad. And often we as an individual don't realize that this is going on. Sometimes it requires somebody else to notice it. And so this could be even subtle things where you get annoyed a little more easily. Something bothers you a little more so. Noises kind of aggravate you a little more than usual, things of that nature. Now, how this can become problematic is there's numerous consequences of getting insufficient sleep. Just on a short term, you're going to have some difficulties with short term memory, because if you're not able to attend to something, you're not going to get it into your working memory, which means there's no hope of you also transferring it to long term memory. Your attention's going to be poor. It can impact your mood. Your reaction time is going to be slower. It's going to impact your ability to learn information. It also is going to compromise your immune function. The other piece of this is it can increase accidents like motor vehicle accidents, work accidents. Hallucinations can occur rarely, but it can occur, and your pain sensitivity can increase, meaning we are going to be less tolerant to pain. We're going to feel it more intensely. And oftentimes these can become problems with just losing 1 hour of sleep per night. Not even on a chronic basis, that's a whole different gambit of things, but even on a short term. Now, sometimes people will talk in terms of sleep deprivation, where they are deprived of sleep or pull an all-nighter. What's important to understand is chronically restricting your sleep, even by 30 minutes to an hour, can start to impact you the same way that chronic or that deprivation can impact you. So even this little bit of missed sleep adds up. The other thing to think of when we're talking about sleep duration is also things that can impact the circadian clock, because that can influence when you're going to feel sleepy or not. Foods high in fats. Remember when I told you that our food impacts our circadian rhythm, and vice versa? Your foods that are high in fat are actually going to send disruption signals to the master clock and cause it to become disrupted, which can impact things. So what do I mean when I say your master clock is disrupted? What happens when that happens? Have you ever been jet lagged? Traveled time zones? That jet lag feeling occurs when the body's master clock and the actual time don't match up. Now, circadian misalignment, or that dysregulation of the circadian clock, occurs when sleep and wakefulness occur at times that are incongruent with biological timing. This is what we refer to as social jet lag. So disruptions of the master clock is linked to serious conditions like diabetes, obesity, cancer, depression, suicide, increased anxiety, cardiovascular disease, anything and everything you can think of any and every problem you can think of can often be traced back to disruption of the master clock, because that master clock is regulating the timing of all of your body's clocks. So if it becomes dysregulated, and that can occur from getting insufficient sleep, it can occur from sleeping at odd times, it can occur when you try to nap and then sleep at night, those kind of things. So it can cause a lot of problems in terms of in terms of health. So if you think about it, this is your body on no sleep, impairs mental focus, increases suicidality, worsens constipation. So think of that circular clock we talked about. So how do you prioritize sleep? So I told you a lot of things and kind of answered some of the questions with regards to what can happen with when we're not getting sleep. How can we tell if we are getting optimal sleep? So how do you start to prioritize sleep? One is identifying what's contributing to insufficient sleep or a wonky schedule. One of the primary things that can happen is choice, or not allowing enough time for sleep, or sleep disorders. So we'll talk about the sleep disorders in just a moment. Psychological conditions can also promote insufficient sleep. Environmental factors like noise, light, temperature, having a bed partner, shift work, traveling time zones, those kind of things. So one thing to look for is, how are your sleep patterns? Are they predictable? Consistent bedtime and wake time. So I call this the same bat time, same bat channel. Are you going to bed relatively at about the same time and waking up at about the same time? Remember that wake up time sets your circadian clock. So if it is inconsistent, it can promote jet lag feeling. So think about how you feel on Monday after you've slept in on Saturday and Sunday. That is like having jet lag. Is it sufficient? Meaning, are you sleeping an age appropriate duration? Think Goldilocks, not too much, not too little. Now, it is not, our bodies really aren't meant to sleep too much, meaning we won't necessarily for a single duration oversleep. But if you're spending a lot of time in bed and some of that time you're sleeping, some you're awake, then you're sleeping again, you might feel like you're oversleeping, but it's because your quality of sleep is impaired. So you are feeling sleepier and it's promoting you sleeping longer. Is your sleep efficient? And this kind of talks to that above point, is time in bed equals time sleeping. Um, if you are in bed, you should be sleeping. If you aren't sleeping, you shouldn't be in bed. The other factor to consider is, how is bedtime prepared for? So we often think of a bedtime routine in terms of kids, but this is very helpful for someone who has insomnia or someone who has a hard time kind of powering down. A bedtime routine, really what it is doing is behaviorally is training your body to associate your bed with sleep, provided that you end your bedtime routine with sleep. Now, if you have a bedtime routine and you end it with being on your phone while in bed, that is not a bedtime routine that is sleep conducive. You have a bedtime routine, but it's ending in something not sleep conducive. So what it's actually doing is training your brain to be awake in bed. So as it goes through those steps, it knows that you're going to end with being on your phone for a bit. So if you want to help promote sleep, you remove that last activity from even being in bed. Do reading, something that's kind of boring, read a textbook, something like that, as long as you don't have an exam you're studying for and it won't make you anxious, and then pop into bed afterwards. Plan for sleep. That is another big one too. So often if you think about it, when you sit down to schedule things, do you make sleep a priority and plan it first? Do you go, okay, I need to make sure I'm getting this much sleep, and then let me schedule everything else? Often we don't. We kind of fit sleep last, or whenever I can get to it. But what if I told you, based on what we've talked about, that if you ensure that you are planning for sleep, you make it a priority, your study time would be reduced because you're more alert, you're able to retain the information, you're not having to go back over things as much because you're now encoding it, transferring it to long term, you're going to be able to recall it because you haven't lost it. So it's going to be also more efficient for you to get sufficient sleep. So plan for it. 7 days a week, even on weekends, follow a fixed schedule. Sometimes it also helps to set an alarm to remind you to go to bed. That can be just as helpful as having an alarm to wake you up in the morning. So you're probably going, well, I have my schedule, but I'm having a hard time following it. Or I can't get up. So plan a primary activity to help yourself get out of bed on time. If it's not a main day where you have to get up for class or do something like that, have something else. Make sure that your alarm clock is moved away from you, so you actually have to get out of bed. Ideally, put it by the light switch, so you turn on the light when you turn it off. When you turn that light on, it's going to start immediately working to reduce your melatonin, because melatonin is not a sleep hormone, it is a night hormone, meaning it comes out to play when light goes away. So as soon as light comes out, melatonin goes away. By that same token, if you're struggling falling asleep, some of that can be the stimulation, which tells the brain it doesn't need to produce melatonin because you still need to be alert, or light exposure can also tell the brain it doesn't need to produce melatonin because it's still daytime, even if it's not daytime. Now, incentivizing yourself to follow a schedule, select a preferred activity or treat that you can only get access to if you follow your schedule. Have an accountability partner, have somebody that you have to check in with, and make it into a game of some sorts where you're trying to beat them awake, not where you wake up too early, but where you're having someone help hold you accountable that you have to kind of answer to. Doesn't mean that they necessarily are going to, do anything awful to you if you don't wake up, but it can sometimes help just having that person that you have to touch base with to demonstrate that you got up, right? Also take a look at what's going on in bed. So if we're not just sleeping, so ideally we want to just be sleeping. And if we're only sleeping in bed, that's what we're going to associate bed with. However, oftentimes we do a lot of other things in bed. And the more other things you do in bed, the more your brain associates those things with wakefulness, which means it's not going to sleep. So what else can you change? Move all electronics and other stimulating activities to another room. Yes, this means your TV. Yes, this means not using your cell phone in bed. It means making sure do not disturb is on and it's out of reach if you have a habit of grabbing it when you can't sleep. If you can't fall asleep within 15-20 minutes, leave bed and only get back in bed when you are sleepy. What this means is if you get out of bed, grab a small pin light, do something kind of boring till you start to do the chicken bob. So that's where your head kind of bobs up and down because you're starting to fall asleep. Get back into bed. Once you feel that way, once you feel sleepy, try again. Rinse and repeat until you fall asleep. You can do this at the beginning of the night if you're having trouble sleeping. You can also do this in the middle of the night if you wake up unable to fall back asleep. Now, caveat to this, if you find that part of what's waking you up is you're frequently urinating, you've already restricted your liquids, you want to get tested for things like type 2 diabetes or obstructive sleep apnea. Obstructive sleep apnea will promote middle of the night urination just based on the physiology of what happens when you're struggling to breathe. For kids, this can result in them actually wetting the bed. For adults, this will result in them needing to get up to urinate frequently. And once they actually treat the apnea, the frequent urination will actually often completely stop. The other thing to consider is what, along the lines of move all electronics and other stimulating activities, as an adult, there's only two things that should be occurring in bed: sleep and sex. Anything else should get moved out of the bed. Ideally, out of the entire room, but definitely out of the bed. Take a look at your diet. So foods that can be helpful are calcium-rich foods that promote melatonin production. Another thing that promotes melatonin naturally or has melatonin in it naturally is cherries. Magnesium-rich foods can help with things like RLS symptoms, so restless leg symptoms. Same thing with iron-rich foods. Potassium-rich foods can promote deep sleep. Foods to avoid is caffeine, alcohol, fatty foods, and fried foods. Now, caffeine, I am a proponent of moderation and judicious use. You have a cup of coffee in the morning to kind of start your day off, not a problem. Caffeine, though, has about a 4 to 6 hour half-life, depending on how you ingest it. So 4 to 6 hours after you ingest it, half of that quantity is still floating around. And just consider this: there's 100 milligrams of caffeine in a cup of coffee. So that's an 8-ounce cup of coffee. If you get a venti from Starbucks, that's a lot more than 8 ounces. Now, you might not objectively feel like you have a lot of caffeine floating around, or subjectively, so sorry. However, it is still going to be there, and it can promote difficulties actually getting into deep sleep and more frequent arousals. It can also promote nighttime urination because it's a dehydrant. Same thing with alcohol. You can experience withdrawals from it in the middle of the night that cause you to need to get up and urinate. Alcohol can also promote apnea symptoms because it's a central nervous system depressant. So it can cause you to snore more frequently, even if you aren't someone prone to apnea. But having alcohol can trigger apnea events and trigger you to wake up and have withdrawals or just not sleep as well because you haven't been breathing like you needed to. Fatty foods, like we talked about before, can promote a dysregulation of your circadian clock. And fatty and fried foods can also lead to nighttime acid reflux, which can cause apnea symptoms because you're having regurgitation of the acid, and it will look sometimes like obstructive sleep apnea, but it's actually acid reflux. And once you treat the acid reflux, the symptoms go away. The other thing to make sure that you do is identify any sleep disorders. So sleep apnea, or what we've been talking about, obstructive sleep apnea, some of the hallmarks are snoring loudly, observed pauses or gasping for air. So pauses in breathing, meaning the person's kind of snoring, so this stereotypical is they're, and then all of a sudden they pause and then they go, make that really loud noise because they've now alerted back awake. What is in essence happening is they are literally pausing and breathing, which means there is a complete or partial flow of air coming into the lungs, which means the body is not getting the oxygen it needs, and the brain cues you to wake up to at least an arousal to get that muscle tone back so you can start breathing regularly. Individuals that experience sleep apnea often also report daytime sleepiness, where they might doze off doing normal daytime activities. Even if they're getting sufficient sleep, their quality is impaired, so they will feel sleepy. Now, the ways to treat sleep apnea are through CPAP or surgery. The gold standard is CPAP. One newer intervention for it is a implantable device that's kind of like a pacemaker, but it's going to trigger tone in the vagal nerve that triggers tone in the tongue, so they maintain integrity of the airway during sleep. Now, if your apnea is caused from allergies or nasal congestion, nasal sprays can help. If your apnea is caused because of acid reflux, treating the acid reflux can help. If your apnea is caused from a certain position, you can try to train yourself not to sleep in that position, but it's typically not super effective because there's not a lot of good body trainers. Most often, though, unfortunately, you have to go with a CPAP. Now, it can be somewhat expensive. There are ways to buy CPAP machines online that aren't as expensive. Or if you have insurance, being able to, the insurance can rent it. Like I said, some of the cost is reduced via home sleep study versus an in-lab sleep study. But the CPAP machine itself, you can buy one secondhand, but you still need somebody to be able to do the settings for it. And there's unfortunately no workarounds if your apnea is not due to allergies or acid reflux. I wish there was a better answer for that, but unfortunately there isn't. The other sleep disorder, one of the other sleep disorders is insomnia. So insomnia is identified as difficulties sleeping 3 nights a week or more. This is trouble falling asleep, staying asleep, or waking before the alarm goes off sufficiently for a sufficient duration where you still have time to go back to sleep, but you can't. Now, some of the most common treatments that are often offered as first line interventions are sleep aids, either over the counter or prescription. Long-term consequences of using these are a dependence on them when they actually stop working effectively. And a lot of times these do stop working effectively. The best tools are those behavioral things we've talked about with regards to having a bedtime routine, making sure that you're moving things out of the room. The other thing I didn't hit on and should have are considering your environment. A box fan or white noise, not rain sounds, music, podcast, anything like that, but a consistent white noise sound that goes zzz. Sounds annoying at first. However, that consistent sound provides a buffer for other sounds, and it's going to help you reduce that arousal you experience with insomnia. So I often call insomnia hypervigilance disorder. So very similar to anxiety. And part of what you have to help do is, in essence, block out external stimulus so the brain doesn't have any new feedback. And once it gets lulled into realizing, oh, that sound is always there. Okay, that's not a new sound. It calms down. Same thing with light exposure. So eye masks can work, blackout curtains, those work great. Consistent schedule is also helpful, that bedtime routine. If you're having a lot of angst leading up to bed, sometimes journaling, but not right before bed. Set up a time for 20 minutes that you're going to sit down, write down all of your thoughts well in advance before bedtime, so you're not activating all that before bed. The other thing that can help is reducing your stimulation. Engaging in that kind of boring activity. Boring for everybody is a little different. For me, I don't find puzzles boring or books boring. So I can't do those right before bed, or I will literally be up until 3, 4 o'clock in the morning. And at that point I'm going, well, I'm almost done. I should go ahead and finish because I'm still wanting to complete the puzzle or the book. So if those things don't work, finding things like adult coloring pages. I've had patients count cards. I've had some read the dictionary. I've had others read Auto Mechanic magazine. So something that will engage them slightly enough to distract them, but not so much that they are stimulated and want to keep doing the activity. Other things that can help are things like deep breathing, progressive muscle relaxation, or other mindfulness types of interventions, visual imagery, those kind of things to help calm the brain, because in essence what you're wanting to do is activate the parasympathetic system to override that sympathetic response. The other disorder that can be prevalent is restless legs, and this is a feeling of unpleasant tingling, creepy crawly feeling in the legs when they're trying to sleep. This onsets in the evening time and can be due to low iron, or it can just be due to restless leg syndrome itself. It happens when they become stationary, they feel an urge to move, the symptoms dissipate. This happens in about 5.5% of adults, can happen more frequently in pregnant women. Disturbed sleep or interruptions in your sleep, like nighttime heartburn, again, can induce sleep apnea type symptoms, nightmares, pain, discomfort, noise, those kind of things. And that can occur in 50 to 75% of adults. So one of the questions I had was if genetics play a role in sleep problems. Yes, there is a genetic factor. However, with things like sleep apnea, increased muscle or increased body mass, whether it's muscle or fat mass, can cause obstructive sleep apnea symptoms. For insomnia, sometimes this is actually due to learned behaviors, not always genetics, meaning you're in a household and it becomes kind of a family belief that we are just bad sleepers. And if you look at the behaviors, though, often the behaviors they engage in don't necessarily promote good sleep. And so it's kind of a double whammy is yes, genetics play a role, but you can counter those genetics by adapting good sleep behaviors and habits that promote healthy sleep. One of the things too is considering the areas in your house you're in that lead up to bed. So for instance, in my house, what I've done is I've set up blackout curtains in all the rooms that we tend to frequent as the evening progresses. So even if it's the middle of the summer and it's bright out until 9:30 at night, as far as the signals we're getting, it's consistent based on what I do with the internal light. And I use lamps, not overhead lights, because then I can better control, again, that light exposure. So real fast, I'm just looking through the list of questions to make sure that we talk about all of the things that we did, all of the questions, and make sure that I hit on them. I think the last thing that I haven't necessarily hit on is best sleep position. And this kind of goes with best mattress or best pillow. It depends on the person. Ideally, you want to be comfortable when you sleep. So the mattress you use, the pillow you use, the position you sleep in are contingent on what you feel comfortable. Now, positions that can promote worse sleep apnea symptoms, if you are prone to apnea, is supine or prone, so sleeping on your stomach or your back. Ideally, somebody with apnea has less symptoms that doesn't go away, so it can't treat it completely, but they have less symptoms if they sleep on their side. But everyone's a little different. Some people struggle sleeping on their side. Some people struggle sleeping on their back, and that's okay too. It's just really about figuring out what works and ensuring that you are sleeping as optimally as possible. Now, if you're needing a sleep specialist, so you're experiencing sleep distorted symptoms and some of the tools that I've discussed aren't necessarily helping, you can seek out a sleep specialist by going to one of these sites. Now, a behavioral sleep medicine specialist is going to help with insomnia, is going to help with circadian disruption, can help with sleep walking, sleep talking, so your partial arousal parasomnias, nightmare disorder, can help with adherence if you are diagnosed with obstructive sleep apnea and are struggling using your CPAP machine or BiPAP. If you feel like you're having obstructive sleep apnea, narcolepsy, which is incredibly rare, only about 1 to 2% of adults, or restless legs, because the primary treatment for restless legs, if it's not an iron deficiency, is medication, is contacting a sleep medicine specialist. And you can go to the AASM accredited sleep center, get tested, and find a sleep medicine specialist via that route. So thank you guys very much for your time. I know you can't actively ask questions. You've already kind of pre-sent questions. However, if you have any particular follow-up questions, you are more than welcome to email me at brandy.roane@unthsc.edu. Thank you very much.